Imagine a world slowly fading to darkness, where your vision narrows and the vibrancy of life dulls. This is the reality for individuals living with retinitis pigmentosa, or RP. Retinitis pigmentosa isn't a single disease, but rather a group of inherited eye disorders that progressively damage the retina, the light-sensitive tissue at the back of your eye. Join us as we delve into the complexities of RP, exploring its causes, symptoms, diagnosis, and the ongoing efforts to combat this sight-threatening condition. The root of retinitis pigmentosa lies in genetics. It's an inherited condition, meaning it's passed down from parents to their children. Specific genes responsible for the proper functioning of the photoreceptor cells, rods and cones in the retina are mutated. These mutations disrupt the normal process within these cells, leading to their gradual degeneration. There are multiple genes involved and different inheritance patterns, including autosomal dominant, autosomal recessive, and X-linked, meaning the way the condition is passed down varies depending on the specific gene affected and whether it is on a sex chromosome. At its core, retinitis pigmentosa involves the progressive breakdown of photoreceptor cells. Typically, rod cells, responsible for night and peripheral vision, are affected first. As these cells degenerate, individuals experience difficulty seeing in low light and a gradual loss of their peripheral vision, leading to tunnel vision. Over time, cone cells, responsible for color vision and central visual acuity, may also become affected, further diminishing vision and leading to difficulties with detail and color perception. This cellular degeneration triggers a cascade of events, including inflammation and further retinal damage, contributing to the progressive nature of the disease. Retinitis pigmentosa affects a significant number of people worldwide, although the exact prevalence varies across different populations. It's estimated to affect approximately 1 in 4,000 people globally, making it a relatively common inherited retinal disease. RP affects all ethnicities and genders equally. Because it is a genetic disease, family history is an important risk factor, and individuals with affected relatives are at an increased risk of developing the condition. The symptoms of retinitis pigmentosa often develop gradually, making early detection challenging. The most common initial symptom is difficulty seeing in dim light or at night, often described as night blindness. As the disease progresses, individuals experience a gradual loss of peripheral vision, leading to a constricted field of view, known as tunnel vision. Other symptoms may include difficulty with color vision, reduced central vision, and increased sensitivity to glare. The severity and progression of symptoms can vary significantly from person to person. Diagnosing retinitis pigmentosa involves a comprehensive eye examination by an ophthalmologist. This typically includes assessing visual acuity, visual field testing to measure the extent of peripheral vision, and a dilated eye exam to examine the retina. Electroretinography, or ERG, is a crucial diagnostic test that measures the electrical activity of the retina and can detect abnormalities in photoreceptor function, even in the early stages of the disease. Genetic testing is also increasingly used to identify specific gene mutations associated with RP, which can help confirm the diagnosis and provide information about the inheritance pattern. While retinitis pigmentosa is broadly classified as a group of disorders, it can be further categorized based on the specific gene mutation involved and the pattern of inheritance. Some common inheritance patterns include autosomal dominant, autosomal recessive, and X-linked. Furthermore, specific genetic mutations can be associated with variations in the age of onset, rate of progression, and the specific retinal areas affected. Understanding the specific type of RP can be helpful in predicting the course of the disease and potential treatment options. Currently, there is no cure for retinitis pigmentosa. However, various treatments and management strategies aim to slow the progression of the disease and improve quality of life. Vitamin A palmitate supplementation has been shown to slightly slow the rate of retinal degeneration in some individuals, but it's essential to discuss this with a doctor as high doses can have side effects. Other strategies include wearing sunglasses to protect the retina from harmful UV radiation, using low vision aids like magnifiers, and participating in visual rehabilitation programs to maximize remaining vision. Gene therapy, such as Luxturna, has been approved for specific forms of RP caused by mutations in the RP65 gene. This therapy involves injecting a healthy copy of the gene into the retina to improve vision. Research is ongoing to develop new and more effective treatments for RP. Since retinitis pigmentosa is a genetically inherited condition, there is no way to prevent it from occurring. However, genetic counseling is recommended for individuals with a family history of RP who are considering having children. Genetic testing can help determine if individuals are carriers of the mutated genes and assess the risk of passing the condition on to their offspring. This information can help families make informed decisions about family planning. The prognosis for individuals with retinitis pigmentosa varies depending on the specific type of RP, the age of onset, and the rate of progression. In many cases, individuals with RP experience a gradual decline in vision over several decades, eventually leading to significant visual impairment or blindness. However, it's important to note that the rate of progression can vary significantly from person to person. Ongoing research is focused on developing new and more effective treatments for RP, including gene therapy, stem cell therapy, and retinal prosthesis, also known as bionic eyes. These advancements hold great promise for preserving and restoring vision in individuals affected by this debilitating condition, offering hope for a brighter future.